I'm Dr. Abby Waldman. I am from Brigham and Women's Hospital, and I'm here with Dr. Carlos Wambier. He is the expert on chemical peels. He is at Brown University in Rhode Island. Thank you for joining me today.
Thanks, Dr. Abby. And we're here in Rio.
We are here in Rio, and you are from Brazil.
I'm from Brazil.
That is amazing. So it is beautiful here. We are here for the International Society of Dermatologic Surgery meeting. And so I had the opportunity to run into Dr. Carlos Wambier and have the opportunity to talk to him today. So I'm gonna put it on you so that we can really get to hear what you have to say. Okay, so to start off, who should have a chemical peel? What are chemical peels good for?
Well, you're asking to the right person. So everybody should have a chemical peel, first of all. Every single person, let's say after 15, maybe after 12, as soon as you start to have acne, you should have chemical peels.
Wow.
So I would say they're good for prevention of aging, but they also treat aging. So you don't need to wait until you're aged to get a chemical peel. I would say a good regimen, that is something that we do in Brazil a lot. So say every person who is concerned about aging on the face, on the winter, they get 3 superficial peels every winter, trying to maintain their youth. And I would say if someone really does that, they age much less.
It makes me feel like I should get a chemical peel right now. I want to like go out and run out and get one.
So let's say
you might be seeing me in Rhode Island soon.
Exactly. So I would say those who are already doing their Botox for wrinkles, why not? Let's say 3 little superficial peels every year just to maintain the beauty of the skin and try to make the old skin, the old layers just peel off.
Who should consider a deeper chemical peel?
There are many indications for a deeper peel. I would say the main one is elastosis. That some people might say photoaging or sun damage that is more advanced. When people have those wrinkles, like lines and those cross lines on their face, they are the perfect candidate for a deep peel. Say it's very difficult to resolve that with something else.
Gotcha.
But then in between, let's say someone who has fine lines or some brown spots on the face, a medium depth peel resolves that. So we call the peels in 3 categories, as you heard: superficial, medium, and deep. The superficial ones are the ones that are just to peel off the epidermis and kind of stimulate the dermis, but they don't really work on the dermis a lot. They don't burn the fibroblasts or the cells that are deeper. The superficial peels, they kind of work like the skincare that you use at home, you know, the retinoids or tretinoin, but what they do is they work faster. So say someone who's using tretinoin, they kind of have the same results of a single peel after using tretinoin for some 4 months. And then with one peel, you just
one and done.
Jumpstart.
Yeah.
You just jumpstart the skincare.
Do most people need one treatment? Do they need several treatments? Does it depend on what type of peel they're using?
Yeah, it depends on what kind of peel. Oh, the superficial peels, they're intended to be multiple sessions.
Gotcha.
They're very light.
How far apart do you space them?
You can go as early as every week, but ideally we wait for full recovery of the corneal layer. So we wait some 2 weeks to peel again. But let's say someone who wants faster results, we can do every week. And then it just works better because the dead skin layer is not completely regenerated. So what happens, the peel works strongly on the second peel.
Nice.
And then you do it again. So we'll say someone who wants better results, they can do it every week for a superficial peel. For a medium depth peel, I would say once a year, that's more than enough. You remove all the freckles or brown spots on the face, or maybe every 10 years do a medium depth peel. I've done twice on my face, a medium depth. And the deep peel is just something like once in a lifetime. It rejuvenates some 30 years or 20 years.
And how soon does it take to see results?
Good question. It depends on the indication.
Okay.
So if you ask me acne, it takes some good 2 months to see the results of acne. Even though you start to see the results in the same week of the peel, and some acne still comes back, so you need to do more peels and wait for the chemicals to work on the oil glands. Then it takes them 2 months. Just like, you know, when we prescribe Accutane, it takes some months to see the results.
Right. And you can do it on active acne, or do you do it mostly after the fact, like acne scars?
No, you can do for controlling acne,
actually.
Yeah, and we do this tretinoin peel, which is, I say it's almost like an Accutane in a peel.
Wow.
It works only where you apply. It's much stronger than what we use at home. So my definition of chemical peels is actually the extreme topical therapy.
Yeah.
Which is something that you don't ask the patients to do at home.
Right.
That you do in your own responsibility as a physician or inside your office.
And would you use that type of acne peel for the same indications as Accutane, like sort of cystic acne or severe recalcitrant?
Controlling oiliness, more severe acne. But the mild acne is the one that responds faster, because then you start the home therapy, and we also associate with antibiotics. We do all the usual routine. We think of peels for acne as an adjuvant. So what's really important is what the patient's using at home, but then you can make things work faster.
Nice. And then for, you know, signs of aging and brown spots, how fast would you expect to see results?
That's 1 week.
1 week.
Because for those, we do a medium depth peel or a deep peel. So as soon as the skin peels off, the brown spots are off.
That's amazing.
And that's really incredible.
So I feel like the big question is always, you know, when lasers came around, a lot of people started using these lasers for these sort of same types of conditions. What would you say would be the differences between the laser treatments versus the chemical peels, and like, why would you use one versus the other?
Yes, that's an amazing question, and I think that's the best message to take home. So lasers, they're the ablative lasers. They're the ones that destroy the skin. They're the ones that we can compare with the medium depth peel, which is also a destructive modality. There is the TCA that destroys where we apply. But then there's a difference. The peel, after it destroys the skin's still there covering. So it's almost like a band-aid. The skin's there, and we know that things heal better under a band-aid. So if you just remove the layers of the skin, then you need to apply a lot of things to pretend that there is a skin on the top. So say when you burn off the skin with CO2 or erbium, which are the things that resemble more the chemical peel, they compete with the TCA peels, right? And then if you try to force the ablative laser to go deeper on the wrinkles, what happens? You scar.
Yeah.
On the same way that if you try to force a TCA peel to go deeper, you scar.
Right.
So we don't do TCA for deep wrinkles, we do deep peels. So the deep peels, they're not ablative like the TCA or CO2 laser or erbium. They're stimulators of skin. They're fertilizers.
Oh.
So what happens, we destroy the top layers with one chemical called phenol that numbs the skin.
Okay.
And then there's an oil from a plant from Indonesia that was found about the time that Brazil was discovered.
Oh my gosh.
1500. The Portuguese found this plant there that is called Croton tiglium nowadays. So we use the oil of that plant to stimulate collagen. And that oil is pro-inflammatory. That means it recruits cells from your own body to digest old skin and also fight infections. So it's a neutrophilic peel, the cells that create pus.
Yeah.
So we use the pus to rejuvenate. And the pus, what happens? Pus does not destroy the stem cells.
Right.
Does not destroy the cells that bring all the skin back. So when we want to remove deep wrinkles, we use the deep peel. We don't ablate to the bottom.
So does that mean, do you need the inflammatory response then to get the effect? So if like you give antibiotics or anti-inflammatories, it will actually reduce.
Yeah. If we wanted only the ablation, we'd use TCA at higher concentrations. And it wouldn't work in the same way. It wouldn't create the same beautiful results we see with the deep peel.
So there's really no equivalent laser then for the deep peel?
there's no equivalent.
Right.
And they tried a lot.
Right.
Peels always, and peels were older than the lasers.
Yeah.
So phenylcroton peels, they started on the 1930s here in the US, or there in the US, and it was probably from some Austrian dermatologists who were researching phenol and also croton oil back then. And anyways, during World War I, someone came to the US and was doing it. And what is interesting is that the deep peel actually heals faster than a medium depth peel.
Oh, weird.
Or a CO2. So say someone that gets a fully ablative CO2 would heal in 14 days.
Yeah.
While perioral phenylcroton oil heals in 5 days.
Really?
Yeah. So it's really like a fertilizer.
That's wild. Yeah. That's not what I would expect. But then do they
But then they're still pink.
They're pink for a while.
4 months. Yeah.
4 months. Okay, gotcha. In terms of numbing, you said like, you know, when you're doing a phenol pill, that actually creates some numbing. But I assume that there's some sort of numbing before the peel. Like, do peels hurt?
TCA peels hurt a lot.
Okay.
That's the one that hurts more, because TCA works by donating protons, or it's really an acid. And what happens, there's the heat that forms while the exchange of electrons and protons happens on the skin. So you can actually measure the temperature of the skin while the TCA is heating the skin and destroying the proteins. While phenol is a cold peel. So we apply, there's no exchange of electrons or phenol. It coagulates the proteins by binding to amino acids, and then there's the coagulation of the proteins that have no temperature, and phenol kind of stings a little bit when it's starting to work, and then it numbs. It's almost like a numbing when you have lidocaine. Yeah. Lidocaine has a little phenol part on the molecule there. So there's a little stinging, and then it's completely numb. That's the phenol. That's why we use it in the deep peels instead of TCA. And I would say the worst part of the pain of the deep peels is actually after the peel. So after 1 hour, when the numbing fades, then you feel the inflammation, the heat of the liquid actually going to the skin. Do you recommend anti-inflammatories like NSAIDs, or do you give pain medicine? The NSAIDs are the things that work the best to control the heat, but the peel is so strong that, you know, and the inflammation is there. We want the inflammation. Yeah, right. You don't want to calm it down too much. We tried corticosteroids to control the heat, or also opioids. Yeah. Nothing works as well as an NSAID. Anyway, so we use numbing creams. Let's see, lidocaine. We use a mask after the peel that has low concentration lidocaine. Okay. That helps. But it's I would say, no pain, no gain. Right, yeah, that's true. There's no way around. See, if you want the results, you have to, the deep peel is like a metamorphosis. Right. You mentioned that for the phenol peel, for the deep peel, you know, it's like 5 days of recovery of that, like, sort of discomfort, plus then 4 months of redness. What other things should people know about recovery for, you know, light, medium, and deep peels? Well, they cannot pull the skin off. Okay. See, my lips are peeling here. That's from Accutane. I'm just taking low dose Accutane. If I pull off the skin, I can scar. Yeah. Because the skin is not ready to be pulled off. Right. So it's very tempting to try to help the skin because it's hanging. Yeah. So people try to pull the skin, and that can create a scar. Yeah. So we usually instruct the patients to moisturize well, so the skin is kind of flaking off when it's ready. We sometimes ask the patients to cut the hanging skin instead of pulling. So there's this complicated part of the healing. Patients cannot go to the sun while they are healing, especially because when the skin just peeled off, there's a bare skin there that has no sun protection, and it can cause more. I always say it's like a baby, right? That skin has like never seen sun. It's like 6 months. You don't get any sun. Perfect. Yeah, we just cover the skin with a lot of sunscreen, and there's a period that the skin is very open to chemicals. Then we even avoid sunscreens. Yeah. Because they can sensitize the skin. So the healing is, I would say, that's the most important part of the peel. Okay. So applying is easy. What about a superficial peel? What do you feel like people should know for a superficial peel? You know, like you were saying, you get like a few of them. Is it the same level of sun protection? Well, I would say the superficial peels, they're the more diverse peels. There are hundreds of superficial peels out there. All right. First of all, you should know what you're having. Say a glycolic peel is a different monster compared to a salicylic acid peel or a tretinoin peel. They work in different ways on the skin, and each one has its own problems and benefits, right? Risks and benefits. I personally avoid large surface of salicylic acid peels because they work like aspirin on the body. So you can get salicylism, or just like taking too much aspirin can cause the ears to ring, things like that. So we avoid, let's say, peeling the full back and chest and the face with salicylic acid on the same day. So for those things, we use the peels that actually are not absorbed, like glycolic or TCA. So it's something to discuss with the dermatologist as well, even though I think superficial peels are the kind of peels that it's okay to get in spas or with a non-medical professional. But you see, even the superficial peels, there's so much nuance about one agent and the other. I would really trust a dermatologist that is a specialist in peels to define the better term. I'll give you an example. Glycolic peel is a peel that actually forms hyaluronic acid on our skin.
Really?
So then, you know, the crepey skin would be the ideal for glycolic. It doesn't work too much on the skin that is too oily. And then glycolic can be a little dangerous when the skin is irritated. So let's say someone has dry skin, if they apply a strong glycolic peel, the glycolic can burn the skin like a meat on that peel. So you have to know which one to use and for which indication. Say for acne, I go with salicylic acid peels because they mix with the oils better. Glycolic is more hydrophilic peel. I use vitamin A peels, which are tretinoin peels for acne. So I would say each person is different. They need different indication. Peels for lightening are different than peels for acne or rosacea.
Gotcha. What would you say if someone is looking to get a chemical peel? How should they go about finding a professional? Because it really does seem like you need somebody who knows what they're doing.
I would really tell someone who really wants to get a chemical peel to go to the International Peeling Society website and check the members of the IPS. Because if someone is really interested in chemical peels, to the depth of really knowing what's the new things and what changes on the scientific concepts, the dogmas that are changing every single year as we learn about healing with peels, they should be a member of the International Peeling Society, go to events and update on constant basis. So say IPS, International Peeling Society, would be a great place to start. Or even go to the AAD website, check the dermatologist there in your area, because even the dermatologists who are not very familiar with all the peels, they have a good sense of what is risky or what's not risky for you.
Right. Gotcha. Is there anybody who should absolutely avoid a chemical peel? And I'm kind of thinking like if you have certain skin color or skin type.
Yeah. Well, there's the medium depth peels are the peels that are actually more dangerous for skin color because they remove the surface of the skin. They also create heat. So we see a lot of dyschromia with patients who are kind of in the gray zone. They're not very white, they're not very dark. They tend to change the color too much. And then the peel needs to be perfectly applied so everything looks the same. So we tend to avoid medium depth peel with someone who is, let's say, Fitzpatrick 5 or 4, or we do lighter peels. Now I just published an article about that. The deep peels seem to be safe for skin of color. And we already have some cases peeled that completely regenerated their normal skin color. And I studied on animal models. So I actually had an experiment with black pigs to peel to see if the color would come back, because the first peeler in the United States, she was African American in California, and the rumors back then would say that she was trying to peel her face to lighten her skin, and And now we know that's a dogma. Let's say they don't lighten the skin. The color comes back, the natural color.
Interesting. Is there anything else that people should know about chemical peels that I did not ask?
Yeah, I would say if you have a tendency for scars, if you have keloids, they're kind of unpredictable, I wouldn't do any medium or deep peels that go to the dermis. They really activate fibroblasts, right? I think that's something everybody should be aware. And sometimes, you know, you need a surgery or something to know if you have a tendency for keloid or not.
Right.
Sometimes the piercings that were done when someone was 1 year old, that doesn't mean that the person doesn't develop a keloid. So you kind of have to know inside of your family, or if you had a cut, something like a surgery, what happened. That's something useful to know.
Excellent. Well, thank you so much. I feel like I learned a ton, and now I'm going to like run out and get a chemical peel, I think.
Let's do it.
Let's do it. Excellent.
It's a pleasure.
Very good.
Abby.
Thank you so much.
Thanks for having me here.
Of course. Thank you.